My name is Sydney and this is my patient Ryan, and we are going to do the part 2 of the health assessment. So first I'm going to start by assessing his abdomen, so you can lay down. Okay, so I'm going to inspect his abdomen, notice any asymmetries or discolorations, any like pulsations, okay? Next I'm going to auscultate, so I'm going to auscultate in all 4 quadrants of his abdomen. Okay, he had normal active bowel sounds. Now I'm going to auscultate for bruit. This is going to be the renal, iliac, femoral, and aortic aortas. And I don't hear any bruits, so I can now percuss all 4 quadrants of his abdomen. Here I'm listening for any dullness or tympany. Now I'm going to do light and then deep palpation in all 4 quadrants, feeling for any enlarged organs or tenderness. Next, I'm going to percuss the liver. The span should be 6 to 12 centimeters. So when I hear dullness, and now I'm going to palpate for the spleen. Take a deep breath in. And I don't feel anything, which is a normal finding. Next, I'm going to have him sit up, and I'm going to test for CVA tenderness. Let me know if this is painful. Okay, great. And lastly, I'm going to percuss for the aorta pulsations. Okay, great. Next, I'm going to do the musculoskeletal range of motion. So I'm going to inspect, palpate, assess for range of motion and strength all at once to benefit the patient. So we'll start with the neck. I'm going to have you, I'm going to inspect and palpate. Everything seems symmetrical. And now I'm going to have him look to the side, other side, up and down. And now push against my hand. Okay, great. Next I'm going to do his shoulders. So his shoulders are symmetrical. I'm going to have you raise your arms and shrug your shoulders. And now push against my hands. Okay, and next will be the elbows. So range of motion here. Open. Okay, close. Now push against me. Next, the wrists, so in and out, up and down, okay. Lastly, it's going to be, I'm going to assess his fingers and hand strength, so grip my hands, great. Next, we're going to do the hips, so you can lay down. So I noticed that his hips are symmetrical, and move your hips out and in. There's no clicking, so now against my hands, and all right. From this position, if it's easier, you can extend and flex your knee. Okay, and the other one. Now go against me. Okay. Okay, great. And now we're gonna do his ankles. So pull towards you and down, and now against me. Okay, and this one. Pull towards you, down. Okay, great. And I'll have you stand up. we're gonna assess the vertebral column, so I'll have you shift side to side and then touch your toes. Okay, great. You can have a seat. Now we're gonna test cognition and memory. So remember these 3 words: banana, spoon, bowl. Okay, what does it mean if I say the apple doesn't far from the tree?
You have similar tendencies than your parents.
Great. And now what were the 3 words that I said?
Banana, spoon, bowl.
Great. So cognitively he is intact. Next we're gonna assess his cranial nerves. So I'm gonna start with cranial nerve 1, which is olfactory or sense of smell. Okay. What do you smell?
Apple cider.
Great. The next cranial nerve is cranial nerve 2, which is visual acuity. So I'll do the peripheral vision. We would normally have a Snellen chart. I don't have one here. So close one of your eyes. How many fingers am I holding up?
3.
Okay. Other side. How many fingers am I holding up?
3.
Okay, great. Next we're gonna do visual cranial nerve 3, which is oculomotor. And then I'm also gonna assess cranial nerve 4 and 6, which is trochlear and abducens. So I'm going to assess for pupillary constriction and lid, as well as the, bless you, 6 ranges of motions. All right, so look straight ahead. Okay, and now follow the light. Don't move your head. Okay, great. Next is 5, which is the trigeminal cranial nerve. Clench your and swallow. Okay. Next is cranial nerve number 7, which is the facial cranial nerve. So I'll have you squeeze your face nice and tight. Smile. Frown. Okay. Next is cranial nerve number 8, which is the auditory. So I would do the whisper test here.
Banana. Apple.
Great. Next is going to be cranial nerves 9 and 10, which is the glossopharyngeal and vagus nerve. So this is where I would do the gag reflex. I'll have him open up his mouth, say ah. And I'm looking that the palate lifts up. Next is cranial nerve 11, which is the spinal nerve. I'll have you shrug your shoulders. Great. And then lastly is cranial nerve number 12, which is the hypoglossal. So I'll have you stick your tongue out and move it side to side. Great. Next, we're going to do the reflexes. So I'm going to do the first reflex. Okay, and then the tricep reflex. Great. And now the brachial reflex. Okay, now moving on, we'll do the patellar reflex. Relax your knee. And the Achilles reflex. Okay, and then the Babinski reflex. Great. Next, we're gonna do the sensations. So close your eyes. Is this hot or cold?
Warm.
Okay, great. Is this sharp or soft?
Sharp.
Okay, great. And then I'll have you open your eyes. Now, what I'm gonna ask you to do is close your eyes and bring your hands out to your nose while your eyes are closed. Okay, great. And lastly, we'll assess gait. So I'll have you stand up and we'll take an accompanied walk together. Okay, and now you can sit back down. Gait is even. All right, and that is all we have for our assessment today. Thank you.